Okay. Let's start, Miss. I just want to make sure I'm on the right slide, everybody. I mean the right, whatever. Let's start, if we can, Miss Osuna. Are you ready to tell us about type 1 diabetes?
Yes, I am.
Thank you, ma'am. Take it away.
It's not letting me share, but that's fine. I'll just talk.
Okay.
So I have diabetes mellitus, or type 1 diabetes, and it is a group of diseases which is characterized by chronic elevated blood glucose levels and disturbances in protein, fat, and carbohydrate metabolism. And this is caused by the insufficient amounts of insulin, which is resistance to insulin by the cells or even both. People with diabetes can use several methods to monitor and adjust their blood glucose levels. Some people do it daily, which determines if they have hypoglycemia, which is low blood sugar, or you can also do a monthly monitor with your glycoglobulin A1Cs, which is done every 2 to 3 months to get an average on their levels. So type 1 diabetes is when the cells are destroyed or damaged, which creates a lack of insulin. And without the insulin, the glucose cannot enter the cells, which creates a dependence on insulin. Type 1 diabetics account for approximately 10% of all diabetes cases. And with this, the destruction of the pancreatic beta cells is thought to be brought on by autoimmune processes, and a strong genetic factor also exists. With type 1 diabetes and massage therapy, if the client does require that insulin, we would recommend avoiding vigorous massage and applying any heat or ice application over the sites of where they recently inserted their insulin injection for at least 24 hours. Massage has been found to increase insulin absorption administered by the injection, and because of this, it can cause or contribute to complications such as low blood sugar. So if they do mention that they do have type 1 diabetes, it's recommended that you ask the client if they carry a glucose meter, tablets, or gel, and where they keep it stored just in case of any emergencies. And with massage therapy, it has been shown that massage overall helps manage diabetes by normalizing blood glucose levels, reducing symptoms or neuropathy, reducing tension, and promoting relaxation.
I love that. Got it. And this type 1 diabetes is essentially diabetes that is you're born with, right?
Yeah.
Yes. Got it. So this is not usually a lifestyle and diet kind of diabetes. This is something where you just are not producing enough insulin to take care of that. Okay, sounds good. And by the way, everybody, well, Miss Clayton, please talk to us.
Oh yeah, it's because I've got type 1 diabetes. I've had it since I was 10.
Yeah.
You can be born with it, but you can also get it at any time in your life. It's very rare that it happens later in life, but they are thinking that very stressful situations can cause your pancreas to basically attack itself because it's an autoimmune disease.
Yes.
I had some really stressful things happen around prior to that, my turning 10. And so our theory in my family is that stress caused the autoimmune process to kick in and destroy my pancreas. But yeah, basically your pancreas, the beta cells no longer work and you don't produce insulin, so you have to take it. So normally the people that take insulin are type 1 diabetics. But my dad's a type 2 and he sometimes takes this insulin too. But I have an insulin pump. And so people have heard it go off because it's constantly monitoring my blood sugar,
Yeah.
and it will go crazy when it's either high or low. So,
Yeah.
but it's pretty challenging to measure it because everything you eat, like it used to be thought that you don't eat sugar, but almost everything you eat breaks down into sugar
Yes.
other than fats and protein, and
Yes.
even fats and proteins can break down into sugar.
Yes.
So it's a very complex thing to manage.
Yes.
And stress and hormones impact your blood sugar. So it's just kind of like this roller coaster that you constantly have to be managing. So
Got it. But it's not a lifestyle-induced diabetes, right? It is.
no, absolutely not.
Right. It is an autoimmune disease, essentially. And by the way, you bring up a really interesting point I think we all need to be aware of. Your immune system's job is to defend your body. And it seems like very high-stress, traumatic situations sometimes kick your immune system into high. And it attacks itself. It's not such a crazy idea. And that's kind of what Miss Clayton is describing. Would you agree, Miss Clayton?
Yeah, absolutely.
Yeah. So thank you for sharing, because I think that's a very telling story.
Oh yeah, no problem.
Yeah, and massage does help, by the way, just by reducing stress levels. You know, it seems to again balance out the hormonal systems in the body and all that good stuff. Okay, Mr. Manzanares.
Hi.
Hi, sir. Mr. Manzanares, you are going to tell us about type 2 diabetes, I hope.
Can you come back to me? Is that on a phone call with my doctor?
Yeah, we can give you a break. We'll come back to you in just a minute.
Thank you.
All right. Mr. Jones. Mr. Jones, you were going to tell us about the cow in Old Yeller's book.
Goiters.
Goiters. Yeah. Mr. Jones, tell us about goiters.
So, goiters is an enlargement of the thyroid gland. And it's any enlargement of the thyroid gland, I've learned.
Oh.
So it can happen to multiple things, but it's an enlargement of the thyroid gland. It may occur during puberty or pregnancy, or in response to the iodine deficiency, which you would get from salt.
Yes.
It says that it's more common in females rather than men, but I'm not sure why. It just says that. And so with massage and goiters, you actually want to avoid it because it can contribute to the development of thyrotoxicosis. Thyrotoxicosis.
Yeah.
Which is a hyperactive thyroid gland, or Graves' disease, I guess is what it's called. Which I'm unfamiliar with, but you don't want to massage it because that will happen.
Right. So it's a local contraindication.
Yes, you can still massage the person, just don't massage the neck, I would say.
And by the way, everybody, you'd know that somebody had this because they'd have a big lump on their neck, and you shouldn't be massaging big lumps on anybody's neck.
It would be very evident.
Yes. So when you see something funky like that you don't understand, leave it alone. Well said, sir. Anything else? Not that there needs to be, just checking.
Oh.
No, we're good. I'm good.
Yep.
Cool.
Just make sure you don't massage on it.
Thank
and
you.
You should be all right.
That's the big part. Local contraindication. Awesome.
Yep.
Hashimoto's disease, Miss Hendrickson. Where did Miss Hendrickson go? Oh, there she is. She's running in here. She's coming. She's got it. Okay. We're ready. All right. Now, we can't hear you, by the way. You're still muted.
Oh, right.
All right.
Okay, so just go to the bathroom real quick. Let me open up my...
Oh, I should have known that because Miss Savarino was in the bathroom, too. So.
Even out of class, we're still...
Yeah, you're still synced up.
Yeah. Okay, let me just find my...
Oh.
Oh, right. Sorry. Computer's coming. Okay. Oh, thank you, Mary. She's like, it's okay, you're gonna do great.
She's a very supportive cat. Yeah.
Yes, it's very supportive. You can help me out through this.
I feel like that's something more a dog would say. I feel like a cat would be like, "Don't blow this."
Yeah, that's
Yeah.
true. Okay, here it is. Alright. So, Hashimoto's disease is a condition in which your immune system attacks your thyroid. Inflammation from Hashimoto's disease, also known as chronic lymphocytic thyroiditis, thyroiditis, often leads to an underactive thyroid gland, hypothyroidism. So, Hashimoto's disease is the most common cause of hypothyroidism. It primarily affects middle-aged women, but it can occur in anyone, men, women, and children. So doctors will test your thyroid function to help detect Hashimoto's disease. Treatment they do treat with thyroid hormone replacement. It's usually simple and effective. You may not notice signs or symptoms at first, or you may notice swelling, so you can get a goiter from this. It typically progresses slowly over years, and it causes chronic thyroid damage, so that'll lead to a drop in the hormone levels of thyroid in your blood.
Yeah.
So the signs and symptoms are of an underactive thyroid gland will be fatigue, sluggishness, increased sensitivity to cold, constipation, pale, dry skin, a puffy face. You can get brittle nails and hair loss, enlargement of the tongue, unexplained weight gain, muscle aches, tenderness and stiffness, joint pain and stiffness, muscle weakness, excessive or prolonged menstrual bleeding, depression, and memory lapses. So if you develop these signs or symptoms, you should see a doctor. If you have tiredness for no apparent reason, dry skin, pale puffy face, or constipation. And then it says you'll also need to see your doctor for periodic testing of your thyroid function. If you've had thyroid surgery, if you've had treatment with radioactive iodine or antithyroid medications, or if you had radiation therapy to your head, neck, or upper chest. If you have high blood cholesterol, you should talk to your doctor about whether hypothyroidism might be a cause. That can lead to it. If you're receiving hormone therapy for hypothyroidism caused by Hashimoto's disease, you need to schedule follow-up visits as often as your doctor recommends, because it's important to make sure you're getting this correct dose of medicine. Your dose may change over time. So it's an autoimmune disorder that causes your immune system creates antibodies that damage your thyroid gland. So doctors don't really know what causes this. Some scientists think a virus or bacteria might trigger the response, and others believe that a genetic flaw may be involved. A combination of factors, heredity, sex, and age might determine your likelihood of developing it. So, like I said, more common in women. It can occur at any age, but it's most common in middle age. And if you have other autoimmune disorders, you're a lot more likely to have it. Like if you have rheumatoid arthritis or type 1 diabetes or lupus. And if you've been exposed to radiation, you're more prone to get it. So you can get a goiter, you can get heart problems from it, so high cholesterol, you can get mental health issues, and myxedemia, which is a rare life-threatening condition. As a result of it, signs and symptoms include drowsiness followed by profound lethargy and unconsciousness. So if you have any extreme changes like that, it's definitely a bad sign. And also it can cause birth defects. So babies born to women with untreated hypothyroidism due to Hashimoto's can have a higher risk of birth defects. So there can be a link, such as cleft palate. Connection also exists between hypothyroid pregnancies and heart, brain, and kidney problem in infants. So if you're planning to get pregnant or if you're in early pregnancy, be sure to check your have your thyroid level checked. And then massage therapy and related body work can benefit hypothyroid patient by firstly a significant reduction in their symptoms can be witnessed with usage of acupressure. It aids their blood and lymphatic circulation. Since proper blood and lymphatic flow is vital to all endocrine organs, the thyroid could benefit from improved circulation. Reduced inflammation is a third benefit. And fourth is reduced stress within the body. This benefit can decrease cortisol and other stress hormones to help manage weight healthily. And finally, increased muscle strength will combat the fatigue and weakness often felt by the patient. Swedish massage, including a large percentage of petrissage strokes, can enhance the size, strength, and stamina of muscle tissue.
Yep.
And finally, as always, if you have an issue there, you want to avoid that area, so avoid the anterior neck area.
Perfect.
That concludes my presentation.
Thank you, Ms. Hendrickson. So to horribly oversimplify, right, it's a hypo, meaning below, thyroid condition. And so you don't put out as much thyroxine and all sorts of stuff. But I think all the symptoms that you discussed shows us how many different things the thyroid affects, right? It doesn't just change one thing. It's not just weight gain. And massage actually helps because it's an autoimmune disorder. And by the way, massage helps all autoimmune disorders, really, because it seems to calm individuals down and their body attacks themselves less when they're calmed down. Yeah. Yes.
Very interesting.
So let me ask you all a very interesting question. Have you started to notice that a lot of these diseases affect women more than men? Besides, do anybody have a guess why? This is open to debate. I mean, I think it's because men are the superior sex and you guys are just inferior. But I thought you might know, I'm totally kidding. I actually think quite the opposite. I actually think women are, and I'm not just saying this because it's politically correct, I actually think women are the stronger sex. So why is this happening to women more? Why is basically every autoimmune disease happening to women more? Ms. Hendrickson, raise your hand.
Well, I think we just have higher levels of stress because there's a lot of responsibility that is mainly put on women, like childcare, and women tend to have to be thinking about their whole family and their, what everybody needs, and that just kind of naturally, it just kind of falls to us more.
I love that.
So there's a lot more stress going on that we have to deal with.
Great answer. Ms. Avalos.
So I do believe that stress is the number one cause for disease in our bodies, and
Yes.
women tend to carry more stress. But I think it's about our chemistry as well. It is different than men's. We have higher levels of female hormones, estrogen in particular, and I think that the combination of stress and our genetic makeup inclines us more to have those types of diseases.
Yeah. No, I love that. I love these. I'm right there with you guys. Ms. Savarino.
I also think, with our society and, growing up, I know, a lot of the older generation, a lot of women were, repressed with their emotions and having to, stuff things down or, not being able to say what they want to say or, do what they want to do. So if you can't do what you want emotionally and you can't release that's why, breathwork and everything is so important. If you can't release that, then it's going to come out in, a physical ailment, in a physical form, because we can't, our internal world ultimately, has so much effect on our physical body as well. So I think that that's a big part, because it's, was a man's world for a really long time, and women were kind of just shoved to the side. So that's my opinion.
And look how good a job we've done with it.
Right.
So, Ms. Savarino, if I hear you correct, and I think I agree with you 100%, you're saying the same thing as Ms. Hendrickson and Ms. Avalos, but you're saying that stress is actually turbocharged because the added stress that women bear is internalized.
Right, exactly, yeah. And I mean, that same goes for men as well. I mean, I know that there's like a lot of men were allowed to show emotions growing up, or like, you have to be the macho man. That's why, it's so important just to go and heal like the inner child, like the inner repressed emotions, because it's gonna cause problems in the adulthood and in our health. So
Very neat.
that's my opinion.
I love it. Miss Clayton.
I was just gonna say basically, what Miss Severina said. I think, when you're born as a female, you start to, mature, and then you're bombarded with all these messages from society that you're the weaker sex, and don't cry like a girl, and so you hear all these negative messages throughout your lifetime. And then a lot of it's backed up with facts and statistics. Men earn more for doing the same work, and I think you start to internalize it. And you can either believe it or you can not believe it, but in either case, it causes you stress.
Yeah.
Just because you're trying to internally fight this message. And then, biologically and chemically, yes, you're different. So I think exactly what you said. It's a combination of factors.
I love that. Thank you for sharing. Miss Carrillo.
I agree with what everyone said, and I also think there's still unanswered things that women go through. Like example, they can sync up their periods, which is a crazy phenomenon. But now it's crazy, and it feels like women tend to, because they're shown emotion, to express emotion easily and unapologetically, they can notice a lot more in their surroundings, and they take in, I think, the surroundings a bit different because of it, so it's the external stress that they take in and notice. Because if I ask my husband, hey, what did this person say? He'll be like, not much. If I ask maybe like my sister-in-law, hey, what they say? Oh, we were talking about this. We were talking about groceries. Like it's just two different ways of thinking.
Yeah.
So I think it's just because we were unapologetically expressing, expressful, is why we can get a lot more stress.
Well, I'm also, if I'm hearing you correctly, I'm also hearing you say that this adds another layer to the stress because you are more emotionally aware of how other people are feeling around you. Whereas, and by the way, everything we're saying here is not true for every woman, and everything we're saying here is not true for every man. This just helps us understand our female clients, for one thing. So I love this discussion. But you're saying, that you would therefore be like, I might be oblivious to some of the stresses in the room, and you'd be like, so-and-so was upset, and you'd notice all that, and that's another layer of stress. Makes sense to me, by the way. Ms. Hendrickson?
Yeah, I just want to add more specifically about what we have to, there's all the, a lot of people were mentioning, messages that we hear a lot, but a lot of things that we don't really consciously realize that we're hearing. It just kind of gets absorbed in our psyche,
Sure.
Especially about being objectified.
Oh, sure.
Because that's something that happens pretty early on for most girls and women, and I mean there are some things like that for boys and men as far as what they're expected to look like or how they develop, but it's a lot more common in girls, I think, and just how we it's like we stop living in our bodies and start being like a observer of our own bodies, because we have to think about how other people view us so much.
Yeah.
So we kind of internalize all these messages about you need to be thin, you need to be pretty, and we spend so much energy and time thinking about how we look and how other people perceive us, and then even celebrities or politicians that are women, they're not judged based on their skill or their opinions. They just, they get asked questions about their wardrobe or their makeup or their relationship.
We shouldn't laugh, but it's that funny.
And so, and if you're a woman and you're ambitious, then you're bossy or you're shrill or you're unlikable, instead of instead of actually talking about what their political opinions are.
The same characteristics we see in a male, we dislike in a female. Yes.
Yeah, like
Right.
exactly, because
Sure.
we'll have like,
No.
oh, if the guy's assertive, it's like, oh, he's, that's assertive, that's good. You're in charge. But if you're a woman and you're that, you're bossy, you're, annoying and stuff like that. So,
Good point.
yeah, a lot of that stuff is just so ingrained in us. And we
It
don't
does.
Really,
It starts at
even
an early
think
age.
about it.
Yeah.
But because I read this book that was really helpful about, I don't remember the title now, but just it's about body image. And a lot of people are like, oh, we want to have positive body image. But I don't think it's like you should only be focused on if the body's like good or bad. It's like your body is good no matter what it looks like, not just trying to say it looks good, because then you're still focusing on what it looks like instead of saying like, this is what my body can do, this is what I enjoy about it, like I can do these sports or I can do this with it. So we just really internalize a lot of that and are used to being treated as objects, even from an early age. So I think that's a lot of stress too, to have to think about yourself that way instead of thinking about your own interests, just thinking about like how people see you. So it really diminishes our capacity for joy and just enjoying our lives in general, because there's so much focus on how we have to look to please others.
So you have a radically different experience. Yes. Mr. Ma.
Yes, sir. I try to share some experience which happened to me and my wife around stress. Like in the past 1 year, my wife had a very heavy hair fall down.
Oh, your hair falling out because of stress.
Yeah. In the beginning, we thought the problem come from the water quality. But it never happened to me. And we just do the water test, but no, the water is fine. So actually, my wife said, "Oh, I know, I'm just overstressed from my mom." Because my mother-in-law has a disease of hyperthyroid disease.
Yes.
This is why I speak out yesterday.
Yes.
Because I know this disease very well. She just try to take care of people from good heart, but sometimes it's over control.
Yes.
I love you guys. I try to treat you guys the best. So I'll make some food with the way I think is best way. I put some herbs, the Chinese herbs, and everything she thinks good. Just put it together and boil it. Hey kids, finish that. It's not a little bit. It's big bowl. After you finish that, because you respect that, you want to say thank you. But after that, you will get another one. So we understand. We accept this good heart, but sometimes it drives my wife crazy. So this is what I said. Maybe the ladies, after 30 years old, your physical fitness is changing. You're not like 18 years old, 20 years old, because my wife's body is changing something like a hair fall down. So this is what I learned from my home.
Thank you for sharing. Also, Mr. Ma poses another question, by the way. Can we care too much? And you guys are about to become caregivers, so please think about that. Can you kind of stop your care at the door? I know that sounds inauthentic, but it might be very authentic because you also want to model taking care of yourself for your clients as well. Ms. Dimitrick.
Women also go to the doctor and find out when there's something wrong instead of suffering through it. So you have more higher incidence in women for a lot of things.
So you're saying, I never even think of that one, Ms. Dimitrick. You're saying that some of this stuff might be present, maybe in fairly equal amounts, but the fact is, men are just, suffering at home and dying or whatever, and women are going to the hospital, and so you are recorded more often. Yeah.
Well, like Katie was saying, thyroid disease takes years to kind of surface. It doesn't like happen overnight.
Right.
So, you know, when I had my thyroid issues, it was just a random scan, and they're like, "Oh, you got a lump here," and then it's like, "Oh, well, let's go deeper."
Yeah, I got you.
And then, so they might go, "I got a lump here. Well, it doesn't hurt. I'm not going to do anything."
Right. Yeah. Good point. A very, very interesting idea. I never even thought about it. Thank you. Mr. Singletary.
Yeah, I have to give praise to all the females here. You guys go through a hell of a lot that I probably didn't pay much attention to. One Halloween, I decided to dress up as a woman for Halloween. It was funny, great. I went to work with full dress, hat, everything, lipstick, everything. But of course, I couldn't do it on my own because I didn't know what I was doing.
No.
So a couple of my coworkers, they dressed me up. Mr. Tapscott, it took hours of painting and styling and squeezing me to girdles, and I was sitting there thinking to myself, they have to go through this every day of their lives.
That says a lot right there. You're right. That talks about a social norm right there. Yeah,
that's a lot of pressure. I mean, look at Miss Hendrickson. Yeah. I'm sure that new hairstyle she's got right now. Do I do it this color? Do I do it this style? Yeah. Do I do it this way? Is somebody going to look at me this way? Is somebody looking at me that way? Maybe this may be too much. Maybe this is maybe too less. I'm sure that's what she went through all that. Yeah. Just getting her hair done. Yeah. And then when you hear girls going, they're in the hair salon for hours and hours, and you think to yourself, Jesus, I'm in there, 20 minutes. I'm in and out of there for a guy.
Oh, yeah.
We don't pay attention to these things.
You don't even need a shower. You just throw on a baseball cap and we're set.
Thank you. And we're out the door. Women don't do that. My nails, my hair, my toenails, am I got the right dress, my underwear, and after a while I thought, good Lord Jesus.
Good Lord Jesus.
And they haven't even gotten to their event where they're going to work or church or wherever. They haven't even gotten there yet. Then they have to come home and if they're married, play the happy housewife.
Yes.
That's another thing. They go through a lot, and ladies, I appreciate you, all of you. You go through a lot. And then let me throw in there, let's get pregnant too. Throw that in there.
Yes. Oh yeah, all that stuff. There's a lot. It's a lot.
It's a lot.
Okay. All right. I there's 4 people with their hands up. I'm going to call on you, but then I've got to move on because this obviously we open up a very big can of worms, which I love. Mr. Richards. Hi.
Yeah, I was thinking the same lot of thing. I think it's social acceptance, and also the body changes for women more than men. Like they go into periods.
Sure.
They obviously about the child, and then once the child's born, they've got the constant worry until they're 18. So I think it's a lot of, social acceptance and also responsibility.
Sure. Thank you. Ms. Creel?
I also wanted to add on to what Mr. Singletary was talking about like how he got dressed and everything. And that's without a period. I don't know about other girls, but we have to worry about the expenses of getting more underwear if we happen to bleed on that too. So we have to buy new clothes if we get blood on that and everything.
Yeah.
So I don't know, some girls have like this is my good underwear and this is my period.
Oh, they do.
I don't care if that gets
they
blood
do.
on it. So it adds up too. So there's always money problems with the makeup.
It is more expensive.
Everything.
It is more expensive to be a woman in our society. There's no doubt about it for a lot of reasons. Mr. Overman.
So I just want to offer another perspective. Not that I don't agree with everything being said.
Sure, please.
But at the same time, women are mean, and y'all do this to each other quite a bit. As far as like judging each other, and I'm thinking high school, of course.
Sure.
But, you got the mean girls, so
you do.
Stop trying to live up to each other's standards.
You do.
But that's not to take away from everything else. I just wanted to put that out there as well.
Well, I think we all do a lot of stuff to ourselves too. Yeah, there's no doubt about that. Kind of a group effort there. Ms. Clayton, you did have your hand up. I don't want you to not be called on. You were my last person if you wanted to say something, madam.
Oh, I just wanted to say thanks to Mr. Singletary. That made me laugh. But it's true, and the thing is, like, I've often said to myself, God, I wish I didn't have to do my hair and makeup today. But then you have that inner pressure, like, I don't want people to think I don't care about myself, and I don't want people to think I'm, so it's just, I'd love to throw on a baseball cap and walk out, but there's all these societal norms and pressures, and it's so much more expensive to be female, and then we make less money, which annoys the hell out of me, because I'm like, I need more money, because I have to buy makeup and get my hair done and all these things.
That's true.
So it's kind of a double-edged sword there, so.
Yeah, I agree. I really agree. I'm glad we had this discussion, because at the very bare minimum, this helps us understand our female clients better. So if you're a male, it helps you understand your female clients better and understand that they see things from a very different perspective than we do, at the very bare minimum. This highlights also a really big discussion that I can't answer for you in this class. I hope you'll answer for yourself. I can tell you where I fall on this discussion, but it doesn't make it right. And that is, does my thinking actually cause disease? Right? Which I'm in that camp personally. But it's, yes, I know you are. So we're like, right. Or is that a bunch of baloney, and is it just these biological kind of things? I kind of think the thinking comes first. If the thinking comes first, then the fact is feeling lots of stress and lots of pressure to conform and do all these things, and internalizing that is doing what? It's using your defenses against yourself, which is an autoimmune disease. I mean, it literally is your body mirroring your thinking. And I had a client who was a cancer doctor. And he told me this years ago. I'll never forget. He was laying on the table. He goes, I don't know why. He goes, but mean people never die of cancer. And I'm like, what? He goes, I'm just telling you, my mean clients never die of cancer. It's always my really nice clients. And I thought about that for years after he told me that. And what do we think about nice people? Do nice people not get angry? No, they get angry. They internalize it. That's why we call them nice. And it's always like that 102-year-old guy who's yelling at the cars and the neighbors and he lives forever kind of thing. So that's the mental side. I want to give you, by the way, one of the biological theories out there really quickly about why women might actually have more autoimmune diseases, because it's kind of a neat idea. When you give birth, and you don't have to give birth for this to happen, but the fact that you are ladies and you can create life, your placenta tries to hide the baby from your body because your body will attack it. It's a foreign body. It's got its own genetics. Remember, it's got some of the dad's genetics in there. So your body does not recognize it. It is truly a foreign body. It's half dad, and it's a foreign body. And so the placenta hides the baby from the body so the body won't attack it and reject it. And one of the things the placenta does is to release hormones, more hormones from this section, right? The placenta releases hormones that turn down a woman's defense mechanisms so that she's less likely to attack the baby, right? And they think that maybe biologically over time, because your immune systems get toned down by the placenta, that your body has actually, and by the way, the placenta is really coming from the baby. It's really the baby's placenta. I know it's in your body, but it's there to protect the baby. So it's kind of a foreign body too. But anyway, the thought is that over the centuries, over thousands of years, women's bodies have raised up their defense mechanism to combat the fact that the placenta brings down your defense mechanism. And if you have a raised up defense mechanism, and most women do, most women have a higher defense mechanism than men on average. Well, when you have too much of a defense mechanism, it's more likely to go attacking stuff. And that might be the reason that we see more autoimmune diseases too, as well. That's your kind of scientific answer. So you've got your kind of metaphysical, I create my own reality answer, and you've got your kind of scientific answer. But all of this gives us great insight socially into our clients, into the struggles of being a woman in this society. And I think it is very hard. And by the way, in no way do I mean to suggest that men don't have struggles. But I think us men tend to have two struggles, which is earn enough money and keep your feelings to yourself. Be strong and earn enough money. And we are allowed to vent some of our feelings through anger. That's acceptable for men, believe it or not. Women tend to have to do everything, and that's a lot. Everything is a lot. Like, a lot. And it's always too much or too little with them, right? So it's a lot. So thank you all for sharing. Mr. Manzanares, we need to hear about type 2 diabetes.
Yes.
Cool. Thank you, sir.
Okay, let's get my notes. Okay. So diabetes mellitus type 2 is sometimes called a lifestyle disease. It is more common in people who don't do enough exercise or live an unhealthy diet or have an unhealthy diet or are obese or overweight. And it is caused by a complex of different things such as genetics or environmental factors, like not being physically active or genetics or a family history.
Yeah.
And type 2 diabetes was previously seen in mostly just older adults, but now it's more common to see young children who are overweight or obese to have diabetes type 2. And some symptoms include being really thirsty and urinating a lot, increased hunger, and feeling tired and all the time, or numbness or tingling in your hands, or unexplained weight loss. And there are treatments such as a healthy eating plan or regular physical exercise, as well as medicine, and also checking your blood pressure and cholesterol, keeping that level in a targeted level, I guess. And there's to diagnose it, there's a test people take. It's called an A1C test. And yes, you can massage the area. No restrictions.
Yeah, thank you.
Pretty much it.
That's it. That's perfect. Really quickly, everybody, and then we'll go on break. So type 2 diabetes is usually associated with like diet and exercise, right? And usually associated with weight gain. So what happens when you have a fat cell is there are insulin receptors on that fat cell. And those insulin receptors, when they pick up insulin, the fat cell says, I will grab sugar out of the blood and put it in here. And we need that. That's a good thing. Well, when you gain weight, you tend to not get more fat cells. Your fat cells get fatter. So they grow. And if you are a receptor, let's say this fat cell has 4 little receptors on it. Let's say it starts this side, so there's a receptor on top, a receptor on the bottom, a receptor here, and a receptor here. There's 4 little receptors. Boom. On this imaginary fat cell. Well, if the fat cell grows this big, it still only has 4 receptors, but they're further apart from each other. And it is much harder for them to pick up the insulin, signal, to pick up the sugar and all that kind of stuff. It creates all sorts of problems, right? And so one of the biggest cures for type 2 diabetes is losing weight, because the fat cell shrinks back down and the insulin receptors are closer together, and insulin works better in your body then. And it is at an epidemic level in our country. We have more diabetes than type 2 diabetes because of our American diets than any other place in the world. So, but you can massage these individuals, and there's no real worries there whatsoever. So, good place to take our break. Let's take our break. Please tell us about the good old kidneys. Don't feel like you have to do a lot here either. We just want what hormones do they produce?
Okay. So the kidneys, the kidneys are 2 reddish-brown organs located bilaterally at the spinal level of T11 to L3. Kidneys secrete erythropoietin. Erythropoietin?
Yeah.
Sorry. and renin. Erythropoietin stimulates the production of red blood cells in bone marrow. Kidney cells that secrete EPO are sensitive to low levels of oxygen in the blood. When they detect a decline, they release EPO to increase red blood cell count, which increases oxygen levels in the blood. Renin increases blood pressure, leading to restoration of pressure needed in the kidneys to filter blood. The secretion of renin is triggered when blood pressure within the kidneys drops. The release of renin by the juxtaglomerular. Sorry, these are like weird words.
Do you know?
But,
oh, go ahead.
It's a type of cell in the kidneys that stimulates the renin. Angiotensin and aldosterone system, which increases blood pressure. And that was all that I had.
That's perfect. Hey, in the future, not just for you, for everybody, you guys can Google pronunciation of a word, and it'll tell you.
Yeah, I did, and then...
Then you forgot.
Yeah.
I got you.
Yeah.
Anyway, but here's what really quickly, to really sum it up, the kidneys produce, they produce hormones mainly that kind of make sure your blood volume stays the same. As much as you don't want high blood pressure, you don't want low blood pressure because you can't get enough blood going around, and your kidneys don't filter your blood very well if the blood pressure is too low. So they help control the actual production of red blood cells and fluid levels in your body in general to make sure that you keep the right pressure in your pipes. Thank you, Ms. Green.
Thank you.
Mr. Godot, can you tell us about the thymus?
Hey, sorry. Give me 1 second.
Okay. I'm going to come right back to you, Mr. Godot.
Okay.
Miss Everson. Miss Everson? Miss Everson? You there? Did we lose you? It is possible we lost you. Miss Everson, going once? Going twice? Miss Everson? All right.
I'm here. I'm just having some difficulty with technology.
Oh, okay. Good. I mean, not good you're having issues with technology, but are you ready to tell us about prostate?
It's short and sweet, and there's not much to say, but there's a lot of pull up my notes. So the prostate is a donut-shaped gland that lies beneath the male urinary bladder and surrounds the urethra. Its job is to relaxin and produce in the prostate. Relaxin is produced in the prostate and is present in semen. After evacuation, relaxin enhances motility of the sperm and fertilization. So it sends the sperm through the urethra rather than going up through the bladder. Up to the bladder, which can cause some problems for men. And it's got a lot of nerve endings that is basically similar to the female clitoris or clitoris. So, fun fact.
Wow, thank you.
But this is relaxing.
Thank you. And relaxin's neat stuff, by the way, everybody. It does help do all that, but females produce relaxin when they are pregnant to help loosen up all your connective tissue so that your hips will spread and make childbirth easier. And it's why we don't stretch pregnant clients, because we can overstretch them. So that's the important takeaway from that. Thank you. Thank you very much. Mr. Godot, sir.
Hi, yeah, I'm ready. Sorry. I was trying to grab some stuff together.
That's good. So the thymus, sir.
Alright. So, thymus hormones are hormones produced by the thymus. They're generally small proteins which regulate the development and selection of the immune competent receptory of T cells and stimulate antibody production by B cells. Let's see. And then it says the thymus is located like in the upper interior part of your chest, directly behind your sternum and between your lungs. And then it says the pinkish gray organ has 2 thymic lobes, and the thymus reaches its maximum weight during puberty.
Yeah. Very cool. So essentially, everybody, your thymus gland, which is located right here in your chest here, has a lot to do with your immune system, and it creates T cells. And I'm sure you've heard of T cells before. T cells are your immune cells, and you've got other ones, by the way, but these are immune cells. And it's something they actually measure to check if you're fighting off a disease. If your T cell count is high, it lets them know you're fighting off a disease. It's actually kind of good if it's high, because you don't want it always high, but it's good. It means your body's responding the right way. And the thymus has an awful lot to do with immune system activity. Miss DeBose, the incredible, amazing placenta.
Okay. Hold on. Hopefully I did this correctly.
We're going to find out.
So, I have the placenta, like the hormones of the placenta.
Cool. Tell us about them.
Wait, what'd you say?
Sorry, I said cool. Tell us about them.
Oh, okay. So what is a placenta? The placenta is an organ that develops in your uterus during pregnancy. This structure provides oxygen and nutrients to your growing baby and removes waste products from your baby's blood.
Yes.
The placenta attaches to the wall of the uterus, and your baby's umbilical cord arises from it. And then on the picture, it just shows you the cervix, and then the little, the dark red part is the placenta. When does it develop? In 4 to 5 weeks of early pregnancy, the blastocyst grows and develops within the lining of the womb. The outer cells reach out to form links with the mother's blood supply, and then after some time, they'll form the placenta. The inner group of cells will then develop into the embryo. By week 12, the placenta is formed and ready to take over the nourishment for the baby. However, it continues to grow throughout your pregnancy, and it's considered to be mature by 34 weeks. So on here are the hormones in pregnancy, but I'm only going to go over the ones that are specifically in the placenta. So you have the human chronic I don't know how to pronounce that, I'm not gonna lie, but it's the first one right here. So they call it the HCG. It's produced by the placenta after implantation. It supports the function of the corpus luteum, a temporary structure in the ovaries essential in early pregnancy, and it's also the hormone detected by pregnancy tests. And then you have progesterone, which is also produced by the placenta. It helps establish the placenta. It stimulates the growth of blood vessels that supply the womb and inhibits contraction of the uterus so it grows as the baby does. It also strengthens the pelvic wall for labor. And then you have estrogen. It helps the uterus grow, maintaining its lining, and helps the fetal organs develop. And then it activates and regulates production of other hormones with progesterone, and it stimulates breast growth and milk duct development. And then you also have relaxin that's produced by the placenta.
It inhibits uterus contractions to prevent premature birth. It relaxes blood cells, increasing blood flow to the placenta and the kidneys. And it relaxes the joints of the pelvis and softens and lengthens the cervix during birth. And then, okay, so massage during pregnancy. The human body produces 50 to 60% more blood during pregnancy, so circulation is essential. Fortunately, massage therapy helps to facilitate it by supporting the return of blood supply to the heart and increasing blood flow to the uterus and placenta. Massage therapy makes it easier for the body to process increased blood volume and ensure proper
venous return.
Venous return to the heart. And then on here, I have this little picture because we were kind of discussing it in class yesterday. Miss Abelos was asking great questions to Miss Bauer about like avoiding certain parts of the body, like on the feet and your hands, for pregnancy, because I guess you can like induce labor or something like that. So I guess there's like a big debate on it, on if that's true or false. But according to the pictures that I found, they still recommend to avoid those areas. And then I kind of put up like the chart of the foot here, and I'm thinking maybe that's why, because like there's parts of your foot that are connected to certain organs, so that could probably affect the baby in some way. But on this little picture here, it says the areas of the body that can be massaged for pregnant women, so the upper back, the area between the shoulders, and I think that says the pelvis. And then you can massage the waist, but it has to be really gentle towards the abdomen. And then you could do calves, legs, and thighs, but again, we have to avoid that like middle inner part of the thigh. And then areas of the body that can't be massaged, so obviously the middle of the stomach. There's a point between the thumb and the forefingers that they say to avoid. And then your heels, toes, and surrounding areas of the feet is something they also said to avoid. But yeah,
Cool.
That's all I have.
That's perfect. No, that's perfect. Thank you. So she brings up many good points, everybody. I do want to weigh in here a little bit because this is a very controversial area. One thing is, by the way, that's very cool is that you have all had a placenta. And what I mean, if you're a male, you've had a placenta, because the placenta actually comes from the baby. It is an organ that is produced by the baby to protect the baby, and it releases hormones, and it seeks out blood from the mother, and it makes sure to take care of the baby. In fact, it can get kind of carried away doing that. So you've all actually had a placenta. It was yours. And it's one of the ways that you do that. Mr. Post, do you have something to say?
Oh yeah, I forgot that you can also eat your placenta and make it into pills after you give birth.
That's right. Some people do. Yes.
Yeah.
So that's a whole other subject, but I'm going to stick to the pregnancy one for now. There is no research to suggest that pressing on these points in the body is an endangerment to the mother. There's none. I often will avoid them out of courtesy to the mother, just because, but there's no research whatsoever that suggests that actually happens. And so in a healthy pregnancy, it's pretty hard to do anything wrong in massage, except have them lay on their back or their stomach. Because the weight of their body will actually, or the weight of the baby or the weight of their body, the baby and the mother together will crush down the abdominal aorta, and that can cut off blood supply to both mother and baby. But you can rub a healthy pregnancy person pretty much any way you want. Obviously, you'd be gentle with the stomach area. We do worry about something called DVT, which is deep vein thrombosis, because pregnant women's clotting ability is higher, and so they can form blood clots in their legs. So if you notice one leg is hot and swollen and the other one's not, you would send them away. You would not massage them. You'd send them away to get an ultrasound really quick to make sure they don't have DVT. But healthy pregnancies, there's not much to worry about. Ms. Hendrickson.
Could you have them in like a reclining position?
Yes.
Just not like laying on their back.
Yes, but it needs to be 45 degrees or higher, which is very reclined.
Okay.
Right?
So that would be like a recliner chair, but not like
just a couple of pillows propping them up. It won't be enough. They need to be really propped up if you're doing it that way. It's usually just easier to go left sideliner on both ways. But yes, you can. Absolutely. And the idea is get them propped up enough that the baby is not pressing against the abdominal aorta. Now, by the way, everything I just said is very controversial in the sense that there are people out there like, oh my gosh, don't touch those points, don't rub the inner thigh, all that stuff. I'm just telling you from my humble opinion that I've never read any research that suggests that that is a problem. One of the biggest fears we have with pregnancy massage, by the way, is that, and I'm sure this is true of people in this classroom, it is not uncommon to lose a child in the first trimester. Not uncommon at all. And that's not a sign of anything, that's not a sign of anything not working right. That's Mother Nature saying something's not correct this time or whatever, and we're not going to develop this child. And so the fear is, if I massage you and you lose the child the next day, you might blame your massage therapist on that. But there's no evidence that those two things are linked whatsoever. And so that, that's just something to consider from a liability point of view. I had lots of female clients and thus lots of pregnancy massages. And I essentially massaged them the same as anybody else except that I had them lay on their side. Ms. Clayton.
So I talked a little bit about this in our lab yesterday, but when I first became a Hand and Stone franchisee 6 years ago, one of our policies was no prenatal massage in the first trimester.
Yeah.
And I thought that was stupid, and I kept researching it to see is there some association and correlation between massage and pregnancy, and it seemed counterintuitive. And there is no research. The research I found said it was actually beneficial and helpful. And so I brought that up to the attention of the CEO at Hand and Stone. And he looked and so what spurred me bringing it to the attention was we had a prenatal client come in. She was, I think, 12 weeks pregnant or 11. And the therapist said, oh no, I can't massage you. You know, I learned in school it was bad and it's against our policy. And she had an absolute fit.
Sure.
She's like, that's discriminatory. I wish I wouldn't have told you, blah, blah, blah. And I kind of took her side. I'm like, you know what, it is. And I would be annoyed if I were, pregnant and wanted a massage and was told I couldn't get one, especially when there's no research. So I brought that up to the CEO and he did research into the legal, aspects of it because he's also an attorney. And he came back and said, we're getting rid of that policy because there is no scientific research that shows that any type of prenatal massage is harmful. And there have only been 2 cases where a prenatal woman has lost her child, a pregnant woman lost her child and sued a massage therapist. And in both cases, the client lost because the judge could find no proof, or during the lawsuit they found no proof that it was harmful. So I just wanted to let people know that, and the research that I found is coming out saying that it's actually very, very, very beneficial for prenatal clients throughout their entire pregnancy to get this off.
I am 100% in Miss Clayton's corner on this one. So that's been my experience too. That's been my research too. I will do a presentation on pregnancy massage with you guys. And this is some of the research that I have read too. By the way, that comes from organizations that are in support of mothers. So research that is from organizations that protect expecting mothers, and they are very pro-massage. And the neat thing about pregnancy massage is studies have shown that people that get regular massage have shorter labor and report less pain. Dramatically so. So it makes for quicker labor and less pain. Right there is the sales point. It also lowers stress levels and makes all sorts of other stuff. There's a lot of evidence to suggest it's actually good for the baby's growth and all sorts of stuff. So it's really good stuff. And I have to be honest, I've massaged quite a few people that at the end of the massage have been like, oh, I'm also pregnant. Should I have mentioned that? And they weren't showing, right? So I didn't have any reason to think they were. But so they were getting deep tissue from me and everything, and nothing. Yeah. Ms. Hendrickson.
I think that, I mean, I don't know if there's any evidence on this, but I think it might be really beneficial for the baby's mental development as well, because when the mother is, especially if the mother's like in high stress, if you lower that stress, like it can help with the mental development, because I think there's some links between like the mom being in a lot of stress or having like a lot of anxiety, and then child having issues because of that. Like
there's not some links on that. There's well documented research. The fact that mothers that are in stressful situations have children that have lots of developmental problems later. And that doesn't mean if you have a child with developmental problems that was the cause. But the fact is there is a definite link between that. So we know that lowering mom's stress helps the baby, the partner, the mom, everybody. Yeah, well said. Thank you. Miss Dimitruk, do you want to tell us about the gastrointestinal tract and the mucus inside it
and all the hormones coming out of there? I sure do.
Yeah, thank you. This is kind of cool.
Okay, the mucosa of the gastrointestinal tract. And again, this is where I went down a little bit of a rabbit hole going here and there. So just bear with me on here. Okay, so one thing I found is that there's 3 phases of secretions in the digestive process, and one is the cephaliac, and that's before you even eat food, where you smell it, you think of it, you just lick it. It starts secretions in your gastrointestinal tract, and it says it counts for about 1/3 of the secretions here. So if you're thinking about Miss Rader's candies and Halloween treats, digestion is starting and hormones are being released. Then there's gastric, where the food enters the stomach, and this phase accounts for about 2/3 of the secretions, and hormones are released here for digestive processes. And then the intestinal, where the food has left the stomach and enters intestines, and again, more hormones are released for this process. And the inner surface of the stomach is lined with a mucous membrane known as the gastric mucosa. The mucosa is always covered by a thick layer of mucus that's secreted by tall columnar epithelia cells.
Yep, epithelial cells. Yep.
Yeah. Okay, so just a little picture of the stomach here and the layers of the stomach on the side. So the mucosa is the most inward layer. And then you have a submucosa, muscle layers, and serosa. Important things that we have also related to the stomach is this pylorus sphincter here that goes into the duodenum. So those we'll be talking about soon. All right, so again, the mucosa is the innermost layer of the GI tract, and it surrounds open space known as lumen. Food, mucus, digestive juices pass through the lumen, and the mucosa comes in direct contact with the digested food, or chyme. The mucosa, singular, or mucosae, singular is mucosa, are highly specialized in each organ of the gastrointestinal tract in order to deal with different digestive tract conditions. The most variation is seen in the epithelium tissue layer of the mucosa. So in the esophagus, the epithelium is stratified, squamous, and non-keratizing for protection purposes. And let's not ask any questions about what these things mean, because we'll just go to a whole nother rabbit hole.
Yes, you will.
But we can look them up, and we'll probably maybe touch on them in the digestive section. Who knows? In the stomach, the epithelium is a simple columnar and is organized as gastric pits and glands to deal with secretion. So we have a little diagram of it over here. And in the small intestine, the epithelium, particularly in the ileum, is specialized for absorption with villi and microvilli, increasing the surface area, and that's where it's going to start pulling in some nutrients for the body. Okay. So we're going to just look at some of the different organs here and see what hormones are created by these organs. So in the stomach here, we get the gastrin, I spelled that wrong, and the ghrelin and the somatostatin, which is also created in other areas, but it's part of the stomach as well. And then in the duodenum and the jejunum, which is part of the small intestine, and there's that ileum we just talked about. There's secretin, the cholecystokinin, or CKK, as we'll refer to it from now on. Gastric inhibitory polypeptide. There's melatonin and gastrin-releasing peptide. So these are just what's going on when you eat something in your stomach, or actually when you're fasting, because that's what the gremlin's related to. And we'll talk about those next. So stomach hormones. So the gastrin, this is triggered by antral distension of the stomach. So when you eat something, your stomach descends a little because you got food in it, and the proteins in the stomach. So the function of this hormone will increase the
chloric acid.
Yes. It stimulates the chief cells to release pepsinogen. It will increase the motility to churn the food in the stomach to digest it. And it increases resistance of the pyloric sphincter to keep the food in the stomach churning before it's ready to continue down the intestines. Yeah. The somatostatin is triggered by food once it goes through the sphincter into the duodenum. And this will help stop the hydrochloric acid release and stop pancreatic and gastric secretions and slow down the GI tract. So once it starts in that duodenum, there's a lot of work that has to be done to that food. Now, if you haven't eaten anything, you're fasting, then the ghrelin is triggered by the fasting. So its function, it mediates hunger, and growth hormones are released. Now, this doesn't make any sense, but that's what I learned on the internet, and we know the internet is not wrong.
Oh, yeah, definitely. But that's very cool. So gastrin helps you when you're digesting. Somatostatin helps you stop that process. And ghrelin, I'm not even familiar with that one. But anyway, it's triggered when you're fasting. Yeah. You're teaching me stuff here. Thank you.
Yeah. And then once food starts getting into the duodenum and the jejunum, the different hormones, secretin, it's triggered. So this is acidic chyme coming in from the stomach is what is triggering this hormone. And its function is to increase pancreatic ductal secretions of the bicarbonate and water to help neutralize the acid. Yeah. And then the CCK, because we're never going to try to pronounce that word again, trigger is triggered by fatty acids in the duodenum. And its functions is to increase mobility of the gallbladder contraction to release bile. CCK triggers the central nervous system to release some ACH, to trigger pancreatic acini, to release enzymes, to release lipases. Again,
lipase.
I don't know what this means.
Yes. Well, it means it all helps you digest fat, basically.
There we go. In layman's terms. Gastric inhibitory polypeptide, the trigger is glucose in the duodenum. So the function then is to release insulin from the pancreas and reduce gastric acid. Melatonin is another hormone triggered by fasting. It activates the migrating motor complex, and every 90 to 120 minutes, the GI system will contract to start pushing your stuff through it, and then this will ultimately increase small bowel and gastric mobility. So even if you're not eating stuff, it's still pushing it through to get it out of there. Gastrin releasing peptide. The trigger is when you're finished eating. So it mediates, satiety, like you're satisfied.
Yes, satiation is what they're talking about. Yeah.
And stimulates the release of most GI hormones. So.
Wow.
Then here's just another chart of all those hormones, and where they get kicked in, and just more description of what happens to the body as that hormone gets kicked in. And what? I don't have my last slide here. Okay, I'm done.
Oh, okay. I don't mean like you shouldn't be done. I think that you just demonstrated for us that we could have an entire course on just the GI tract, the gastrointestinal tract. But essentially, by the way, it produces hormones that turn on the stuff that eats certain foods and helps you break down fats and proteins and sugars if those are present, and then it turns all that stuff off again, and it makes sure to keep everything kind of pumping through the system. Very cool.
Yes.
Very cool. Thank you. Very, very detailed. There were hormones in there I've actually never heard of, I'll be very honest. So, thank you. Thank you. Mr. Craven.
Yes, sir.
Very interesting. You have the heart, sir.
Yes, a lot less detailed. Really just going to stick to the heart of the issue here.
Yes, just yes. Keep it close to the chest. Okay.
Of course. So, heart hormones. Now I know what you're thinking. The heart produces hormones? Since when? Well, have you ever been so happy or know someone who has been so happy that they peed themselves? Okay, stay with me here. That's your heart at work right there. Secreting natriuretic hormones, also known as ANH, which tells the kidneys to increase urine production, which then tells you that it's probably time for a new change of underwear. Now, you would think that ruining your favorite Superman undies would cause your blood pressure to skyrocket, but to the contrary, ANH actually causes your blood pressure to decrease. So the next time that there's an accident, maybe it's time for a heartfelt apology.
That's good. Thank you, sir. I love that presentation. I really mean that. I'm not just saying that. Yeah, the heart, as you so comically put, though, the heart works very closely with the kidneys to keep proper blood pressure in your body, and it really does that by fluid regulation. So it sends a signal to the kidneys like, we got to dump stuff overboard because we got too much pressure in here. And so very, very cool. I love that. Thank you. That will stick with me forever. Okay, Miss Clayton. Adipocytes. What are adipocytes? Miss Clayton? Dear Miss Clayton?
I'm here. I'm having that same issue with sharing my screen.
Yeah, no problem. Your screen is black, by the way. I don't know if that tells you anything, but... I mean,
well, I'm pressing the share button, and it's not.
We don't see. I don't see you. I don't see anything.
Let me see if I can turn.
Okay, that's
weird. Let me try this. Okay, I think it's working now. Okay, there we go.
I think.
Yeah, that helps. Can you see it now?
Oh, hey, yeah. We got it.
All right.
There we go.
Now, I was gonna try to be brief and have one screen, but it did not happen.
Okay.
Like as Demetrix said, you can kind of go down a rabbit hole. So anyway, adipocyte is a fat cell. This fat cell here is a French fat cell, which tells me the French have fat cells too. So good to know. This picture here on the right are fat cells, and they kind of reminded me of donuts, which I thought was fantastic.
Jelly donuts,
jelly-filled donuts, which I thought was appropriate.
Yeah.
So, adipocytes are the little cells that make up adipose tissue. Adipose tissue is the nice word to say fat. So, people that are heavier have more adipose tissue.
That's right.
It's a connective tissue, and lipid-rich cells called adipocytes, which just basically means they have fat, which are in the form of triglycerides. So only vertebrates, so organisms with a backbone, have adipocytes. So we're all kind of special that we have adipocytes. And the main function of this tissue is to store energy for us in case of emergencies. We normally use glucose or sugar as our number one form of energy, but when we run out of that, we can use our fat as energy. It's divided into two types in our bodies. There's the parietal, which is under the skin, which is the normal thing we think of as fat. You know, if you grab your love handles, that's the parietal. And then we have the visceral, which is very important, and it surrounds the organs. So basically, the fat cells are like little microscopic balloons, and they have the ability to grow in size well beyond their original size. And they basically soak up any extra energy in the blood, and they take it into their cells, suck it in like a sponge. And that's why it's so easy to gain weight. When we lose weight, the cells don't disappear, they just shrink in size. So these guys shrink in size, they expand, they shrink, they expand, and so forth. There's different types of adipocytes. There's the white adipocytes, which were just at the visuals that I showed were actually the white adipocytes, which they look a little bit more yellow than white, but they're called white. And they're a single large liquid droplet that I showed, that the ones that look like the little donuts. And then there's the brown and beige, and they store energy, and they have a bunch of little droplets in their cells. And their goal is to burn energy and generate heat. So one of the things that, you probably have all noticed is that a lot of times thinner people tend to run cold. Sorry, my dog is eating like a crazy animal. She licks the bowl, so she's licking the bowl right now. But the thin people generally run colder, and larger people run warmer. And that's because they have the ability, the larger people, to generate more heat. So that is very true. Energy is their main function, but they also do a few other things that are really important. One is they produce leptin and resistance. So leptin is a chemical that inhibits your hunger. So when I read this, I thought, well, why the heck are fat people fat if they have more leptin, which reduces your hunger? So I'll explain that. And then they have something called resistin. And resistin inhibits insulin's ability to work, thus increases the blood sugar levels. And so this is that link to type 2 diabetes and what you were talking about earlier, Mr. Tapscott. So in addition to the receptors becoming wider. So, and then they also, resistin also produces higher levels of cholesterol. And that's why a lot of times overweight people develop type 2 diabetes. And overweight people generally have high levels of cholesterol, and it's the bad cholesterol, the LDL, which I always think of, because I try to remember HDL is the healthy, and LDL is the loser, so it's the bad LDL. And then it plays a protective role. So if we didn't have fat, we would be very uncomfortable when we sat down on chairs. We would also be uncomfortable when we slept because our bones would be, pressing against the pillow. And then our eyeballs would probably fall out. So there was a quote here about the visceral fat, and it said, the eye, for example, is surrounded by fat in a manner analogous to the way one might pack a teacup in bubble wrap. And one nice thing is that when we do lose weight, the visceral fat remains undiminished or unchanged, and that's important because obviously if we our eyeballs lost weight, they might fall out. So good for visceral fat, staying the same. And then, as a rule, and this is probably no shock to anyone, but women, their bodies accumulate more fat than men. Normal body fat for women is about 20 to 25%, where men it's generally 10+%, 10 to 15%. And I'm sure Mr. Jones knows a lot about this, being in bodybuilding, and I don't think he has very high body fat. Men tend to store more visceral fat, which is interesting, around their internal organs, and that's why, generally speaking, men, when they're overweight, tend to accumulate more weight in their middle and their abdomen, whereas women, generally, their extra weight goes onto their thighs and their glutes and buttocks. So, and the difference between beyond the difference, there is the different females that are produced, or different hormones that are produced between men and women, which signal to the body where to store that extra fat. I talked about sugar and fat. So sugar's the number one fuel we use, and when we run out of that, we go into the using fat. But it is a chemical reaction that has to occur for that fat to kick in and start burning calories. And then one other thing about fat cells is they only generate in some parts of the body. You know, our ears aren't fat, our nose, our forehead, around our joints normally don't have fat. So we don't need to worry if we're going to gain weight that our nose is going to get bigger or anything like that. So that's good news. And then finally, leptin resistance. So when I read that, leptin is the chemical messenger that tells your body, hey, stop eating, you're full. And fat people produce, or, people that have more fat cells produce more leptin. It was kind of counterintuitive. So, but the reason that is because the more leptin you produce, the more your body becomes desensitized to it. So a lot of times, you're producing so much when you're overweight that your body says, the cells become less receptive to it. And then the other reason they said is inflammation. So with people that are overweight or have too much adipose tissue, they tend to be inflamed internally, and it causes a lot of challenges with receptors. And inflammation dulls the brain's leptin receptor site, so the body doesn't perceive the leptin. So it's kind of one of those catch-22s. It doesn't perceive it, so it produces more, and the more it produces, the less it receives it, and it's this kind of catch-22. And then, in addition to having a leptin, excess leptin, it makes you very tired and histamine intolerant, which means you're going to have more allergies and other problems. So, and that is the beautiful adipocyte and adipose tissue.
That was fantastic. Thank you. I'm glad you went over all that. That was just fantastic. Thank you.
Sure.
Good stuff. Okay. Miss Carrillo, are you still working on your presentation?
I think I just finished it, like right now. There's a different thing I could work on, but the thing is, it kind of fits with this, so I left it in. So.
Good. All right. Well, Miss Carrillo,
you
are going to tell us about hormones associated with stress. Of course, everybody, this ties into massage very acutely. So, Miss Carrillo, if you don't mind, please enlighten us about hormones associated with stress.
Okay, everyone. So I do have a presentation. I do want to say I also went down a rabbit hole, and I ended up in Wonderland. So the easier question would have been, what hormone isn't associated with stress? And I have a big list and a few pictures. So let's get started. And I forgot to present. I just opened my screen and that was it. I'm so out of it. All right, can you see the blank canvas?
Let's see. Yes, I can.
Okay, here we go. We got hormones associated with stress.
Oh, I love it.
So there are actually different types of stress. The stresses can be physical, which also include internal. So this is like broken bones, aches in your body, things being wrong with like your organs. There's also external, which are things that are out of your control but are still causing you stress, like a teacher giving you an assignment and stuff like that. And then there's a psychological stress. An example of this is like anxiety. So I actually ran into something that tied into what activates a lot of hormones based on stress, and that is called the general adaptation syndrome. It has like 3 stages: alarm, resistance, and exhaustion. This is basically like gas for your body, and I will say what gets activated during these stages, and then I'll show you a bunch of other stuff I learned about the stress hormones. So stage 1 is the alarm reaction. This is the fight or flight. This can last minutes to a few hours. So in this stage, the lymphatic nervous system is affected, and AMEN, which is the adrenal medulla, which activates the I need help, Mr. Tapscott.
Epinephrine. Epinephrine.
Epinephrine and norepinephrine.
Yeah.
So when these are activated, the liver, when these hormones are activated, that is caused by our fight or flight, which is caused by stress, the liver breaks down the glucogen to raise the blood glucose level. This is called the glucagon. And when the glucose levels, its main type, the main type is sugar in the blood, and sugar gives energy. So gas, which is G, which is for glucagon, is basically our energy. So then we go into stage 2, which is resistance, which is the adapting. This can last days to weeks, and this is when we're resisting the stress. This is when our stored gas, the glycogen, is depleted, and now we're going to be using too much fuel. So the adrenal cortex, releases the glucocorticoids, such as cortisol, which also releases the gluconeogenesis, and that means formation of new glucose in the liver. And cortisol, I have it. I have so much stuff written, guys. Like,
you're doing great. This is great. This is really good.
But basically, the GNG, which is the gluconeogenesis, makes a metabolic pathway when carbs are unavailable to maintain glucose levels. And cortisol basically helps ensure glucose, lipids, and amino acids are available for energy during the times of stress. So this is your body trying to use everything inside of you. The liposis makes free fatty acids broken down through beta oxidation to power the mitochondria in muscles or fatty acids, and can be converted into ketone bodies by the liver that can go on to fuel other parts of your body. And amino acids are broken down everywhere, used as a short-term fuel source in any mitochondria that can get them, if not enough, glucose. So basically, this is your body trying to just take it from where it's at. So it started from here. Whoops, my bad. It started like from here, but now we're kind of past like this comfort level of what our body can give naturally, and now it's taken from everywhere. And so, and also during this time, inflammation and the immune system are suppressed because we're in that very high alert state, and this also messes with our digestive system. And then this is the one I left in. Be ready. I don't know if you could tell the difference. Stage 3, exhaustion. Let me try to decipher what I wrote, guys. fat stores, fat stores, fat stores depleted. The protein is broke, so it's broken down, and the muscles are wasting away. The organs can't work effectively anymore, and the prolonged suppression of the immune system because of the stress can lead to disease. So suppressed IMS equals disease, and then extreme of that can equal death. So what I did, what took up so much time, I actually went and I looked at what, I had to look up all these words and all these hormones, and well, there's a lot.
Oh my gosh.
They're all connected.
Yes. That's stressful.
Like, in the penile, we have melatonin. The penile, it has melatonin, which controls biorhythms, which if you have anxiety, that's going to be crazy. In the pancreas gland, you got the glucagon, which increases blood glucose levels, and insulin, which decreases. It messes with your blood glucose levels. The parathyroids, the parathyroid hormone increases blood calcium levels. So it messes with your blood calcium levels. Thyroid, calcitonin, it decreases blood calcium levels, so it goes with this one up here. Hold on. Stop it. I'm so sorry.
You're fine.
I don't know what happened.
Taking a very complex subject, doing a great job.
So much. So this one is in relation to this one. So T3, which is the triiothyronin, and T4, which is the tetriiothyronin and/or thyroxine, regulates metabolism. So this messes with your metabolism. So you're either going to poop or pee a lot. That's fun. Adrenal medulla, which is what I briefly touched on, which is the Mr. Tesco.
Epinephrine.
Epinephrine. That's like my husband. Epinephrine. What?
Epinephrine. Yeah.
Epinephrine.
Yep.
Epinephrine, which is the adrenaline,
yeah.
And norepinephrine, which is noradrenaline, is bind to sympathetic effectors, so it enhances and prolongs the physiologic effects of stress.
Yes.
So testes, testosterone, this affects the libido and the sperm production.
Yes.
Ovaries, it affects your estrogen, your menstrual cycle, and deposition of fat, which it could increase your abdominal fat because it's going wherever it wants. Posterior pituitary, it affects the anti-diuretic hormone, which decreases urine production. And then there's like this custody battle going on in here. This was really interesting. So over here we have the interior pituitary, which has the adrenocorticotropic hormone, which stimulates the adrenal cortex to secrete hormones like cortisol. And then adrenal cortex makes cortisol, which helps with share glucose, lipids, and amino acids, which is energy during times of stress. Then we have the kidneys, and it gives off this renin, and I was like, what is this? Why is this in here? And it controls production of the angiotensin, which has the vasoconstriction, increase in blood pressure, and it also controls aldosterone, which maintains sodium levels. So because it can affect these things,
yes.
It has a system. This is called RAS, which is renin, angiotensin, and aldosterone, which affects your blood pressure and your fluid and electrolyte balance, which also means in the system vascular resistance it affects your resistance to blood flow. It can constrict and narrow it. So stress can really mess you up. But, so examples, let me just say there are examples of this. There's two types of stresses. There's distress, which is negative, and eustress, EU stress, positive. Distress is like for yourself or someone special, which is injury or illness, being abused or neglected, money problems, sleep problems, which we're pretty familiar with. Eustress, which is the positive, which can actually help in all these, is like promotion, raise at work, marriage, taking a vacation, educational classes, getting a massage. Yes, massage. But there is good and there is bad stress. A lot of the bad stress does affect us, but the good stress can help fix it. As long as you take care of yourself, meditation, dancing, just things like that to help keep these hormones in line, because stress actually controls. Like, it has like a hold on your whole body as it controls the gas and the fuel of your body.
Beautiful.
Oh my God.
That was fantastic. It was really fantastic.
Huh? Oh God. That was it. I was so sorry.
That's fantastic. So she makes a really good point, which we've all been dancing around today, right? Stress affects everything. Everything. Because your body says, I'm on high alert, and I need to now control all my systems and ramp some up and shut others down. And it's not a problem if you don't exist in that state, if you get out of stressful states. It's just not a state you want to stay in. Yeah, really well done. Thank you. I learned a lot. I learned a lot.
Me too, man. I got it pretty good out. I told Stavros, I'm like, I gotta cut it off somewhere.
Yeah, I mean, frankly, I appreciate that too. Like, it's just a lot. And at some point, we're just like, but I think you captured how massive the subject area is and the big takeaway from that, you know, about what it does to our body. So thank you. Thank you, thank you, thank you. So I got a little stressed out just watching that presentation about stress. So now we need to hear about hormones that are associated with rest and feelings of well-being and healing and things like that. So Miss Avalos, madam, are you ready?
I'm ready.
Please.
So I have the rest and wellness hormones, and so I'm kind of like a firm believer after I started researching that there really isn't a good or bad hormone. So here's kind of what I came up with. All right, so hormones affect more than just your mood. The vital chemicals enable daily bodily functions from repair, reproduction, movement, and more. Hormones are special chemicals that travel through the bloodstream. I like to think of them as like the body's internal Wi-Fi. They carry messages from the glands or the organs where they're produced to cells in different parts of the body. They literally talk all day long. They help turn on and turn off cellular processes that control anything from your appetite, growth, stress, blood sugar, sleep cycles, sex drive, and sexual functions. That's just to name a few. You know, hormonal is not a synonym of moody. Hormones do affect the mood, but they do so much more in the body than that. You know, eat, breathe, love. Hormones help you do all of that, from basic functions like heart rate and hunger to complex like reproduction and emotions. There tends to be a need of balance between all of your hormones in order to function properly and have optimum wellness. So you need the quote unquote good hormones and the bad hormones in order to reach balance, and your body craves that constantly. We overtask our bodies on a daily basis. We tend to spend more time in flight or fight than we take for rest and recovery. When we're in that state, it impacts your nervous system and your hormones. You will see your body respond to the hormone changes in the way that you function. You'll have fatigue, increased heart rate, anxiety, panic attacks, colds, sore throats, injuries, moodiness, and the list just goes on and on about how when there's no balance, your hormones can affect your system. But when you are overstressed, for the sake of this assignment, you can cultivate feel-good hormones. Dopamine's in the pituitary gland. It's often called the happy hormone. It's a primary driver of the brain's reward system. It spikes when you experience something pleasurable. It's the high that you get from food, sex, shopping, anything that you find enjoyable. Serotonin is in the pineal gland and the digestive tract or the gut. It's a feel-good hormone. It plays a key role in fighting off anxiety and depression. Exercise, spending time outdoors, good night's sleep can boost your serotonin. You have endorphins, and that's in the pituitary glands in the central nervous system. It's commonly linked with exercise, and cardio is the best way to increase endorphins. They're your natural painkillers, and they minimize discomfort and maximize your pleasure. Oxytocin's in the pituitary gland and the hypothalamus, and it's the love hormone. It's known for its role in bonding and forming attachments. It spikes when there's any type of intimate touch and holding hands, cuddling, kissing, massage, and even sex. Most people who work out have realized that you have to rest your body, and intense workout temporarily increases stress on the body, and you have to rest in order to progress. And rest allows your hormone system to reset. Melatonin, which is considered a rest hormone, is a hormone that's released at night by the pineal gland. It controls your sleep cycle. There's also growth hormones known as HGH that are released during rest. It is produced by the pituitary gland, and it helps regulate so much your body composition, bodily fluids, muscle tissues, and bones. And it can also affect your metabolism, such as insulin action and blood sugar levels. So this assignment asked me about wellness hormones, and I've already stated that we need all of them for your optimum health and wellness. So I can't list all of those because we could be going on for a long time. And human beings like to divide things into two categories. You have good, bad, black, white, hot, and cold, but our Creator likes to make things in three. You have the vertical, the horizontal, and the inverted, liquid, solid, gas, body, mind, and soul. There is always a balance in life that we tend to overlook. So we classify things as good because it makes us feel good, but too much of a good thing is actually a bad thing. When good hormones and high amounts are in your system, it can have a disastrous effect. You can have so much oxytocin in your system that it ruptures your uterus. You can have so much serotonin that it causes restlessness, hallucinations, strong delusion, and fluctuating blood pressure. Too much melatonin can have the opposite effect and cause restlessness. And when you do finally get to sleep, you have horrific nightmares. So your life is constantly like this pendulum right here, and you're swinging in between good and bad constantly, and it's from one aspect to another, and your hormones do the same thing. So what happens when you break that cycle is you have balance, and there's this calm homeostasis that occurs inside of your body. Your overall health and wellness is about balancing the stress and the rest. And balance is wellness. So if more people focused on balance than what feels good or bad, then we would have a greater wellness that positively impacts our physical, mental, and spiritual health. I encourage you all to try and create a balance inside of your hormones and break the cycle. And the ways that you can do that is removing toxic behaviors, remove your toxic thoughts, your toxic foods, forgive yourself and others, keep practicing that daily gratitude, and that creates balance and a better being of wellness. So that completes my presentation. I don't know if it answered it or not, but I feel that it might have.
Oh my god! Oh my gosh! It was fantastic, Ms. Ablos, and I appreciate you taking a more expansive view on the assignment. Thank you. You know what I mean? I really appreciate you giving us it better. She's absolutely right? There's not good or bad hormones in your body. Your body's amazing. It is about balance and all those things. Thank you. Yes, it's fantastic. Miss Clayton, you raised your hand.
Yeah, that was a great presentation. What was the hormone, or what did you say causes the nightmares?
Too much melatonin.
Too much melatonin. Okay.
Right.
Good to know. Good to know. Yes. Awesome. Okay, we've got time for some really quick presentations still. Mr. Lee, you were just going to practice saying some muscles for me.
Okay.
Yes. What are the 3 calf muscles, sir?
3 calf muscle is gastrocnemius.
Yes.
Plantaris.
Perfect.
Plantaris.
Yes. What are the 3 hamstrings?
The hamstrings muscle is biceps femoris, semimembranosus, simultendinosus.
Perfect. What are the 3 gluteals?
3 gluteal muscles. Gluteus maximus, gluteus medius, gluteus minimus.
Beautiful. And last but not least, what are the 3 erector spinae muscles?
Spinalis.
Yes.
Longissimus.
Yes.
Auscustalis. I don't know how to pronounce this one. Auscustalis.
Costalis.
Costalis.
Beautiful. Thank you.
Costalis.
Awesome, sir. Thank you. Thank you. Exactly what I wanted. I appreciate it. Miss Lee.
Hello.
Hello, Miss Lee. What are the 5 hip adductor muscles found between my legs?
The hip adductors muscles, adductor longus, adductor brevis,
yes,
adductor magus, and gracilis, and pectineus.
Yes. I feel like you had an extra one in there, but that's all right. Keep going. You're good. And what are the deep 6 lateral hip rotators that are found underneath my gluteus maximus?
Yeah. And a deep 6 lateral hip rotators, piriformis, gemellus superior, and aterator, after internet, and gemellus inferior. Aterator externus, and quadratus femoris.
Quadratus femoris. Beautiful. Thank you, Miss Lee. Nicely done. Thank you. Thank you.
Thank you. Thank you.
Miss Dang. Miss Dang. Oh, there you are. Hi, Miss Dang.
Yes.
Miss Dang, what are the muscles that attach to the medial border of the scapula.
Okay. So, sorry, because I'm ready to go out, go the way to school. Okay, now first is the run for the major, and the second is run for the minor, the another is levator scapula, and the fourth is the serratus anterior.
Serratus anterior. Beautiful. Thank you, ma'am. Thank you, thank you.
Thank you. Thank you.
Thank you, thank you. Mr. Ma.
Yes, sir.
Mr. Ma, what are the 5 abdominal muscles?
Okay, so it's external oblique, internal oblique, quadratus lumbarum, restus abdominis, and transverse abdominal.
Yeah, that was awesome. Hey, do you know, can I ask you a couple questions about them really quick?
Yes, sir.
He's like, what choice do you have, huh? Which one of those abdominal muscles helps me with turning? I don't care which way, but which ones help me with turning? Rotating.
Restus abdominis?
No, rectus abdominis would help me with bending.
Oh.
These would have to be kind of diagonal.
Transverse?
Transverse actually kind of just squeeze it. We haven't done these yet. I just thought you might be like, yes. All right. Let me let that go. By the way, the diagonal ones would help you with twisting. The diagonal ones. And so that's your internal, external obliques. They're diagonal. They run at an angle, and they help you turn. So
Can I say it again? What was the name of that?
So, you're probably not familiar with the word. You have the internal and external obliques are diagonal. They run at an angle. They don't run across. They don't run straight up and down. They run at an angle. We call that diagonal. And because they run diagonal, they help me turn.
Diagonal.
Yeah.
Diagonal.
Yeah, it's a hard word. Anyway, those are the internal, external obliques. When you guys are doing the twist, that dance that we all did in our lifetime, sure. Okay. Anyway, thank you, Miss Dimitruk. She's done the twist. Anyway, that would be your internal, external obliques. Forget it, let it go. That was fantastic. Thank you, sir. Thank you, thank you, thank you. I don't think we have time for another presentation. Let me make sure homework is released and all that good stuff that I should have already done. Here, let's see. Hold on. Boom, boom, boom. Bear with me 1 second. Sure. All right. You have 2 assignments. One will make sense. One, in a way, Mr. Ma just introduced us to, is a video on the abdominals to prepare for talking about them tomorrow. And the other one is a test on the endocrine system, of course. Of course. I know that we did not get to all presentations. I think we will have time for them tomorrow. So that's all good. You should be able to see your homework right now. 2 assignments. Video on the abdominals. And test on the endocrine system. For all of those that you presented already, thank you. Well done. Good job. Please return to a state of rest and relaxation. Let the stress go. Yes. Well done. I was really enlightened today. Like, I learned stuff today. And I've been doing this class for a while. So thank you. And by the way, I learned scientific stuff today, and I learned kind of big picture stuff and more emotional stuff today too. So thank you. I love it when I get all that in one dose, one class. All right. We got 3 minutes left. I'll be right back to say goodbye to you guys. Hang out for 3 minutes, please, please, please. Oh, I just hear a question. Yeah, Mr. Singletary, please.
It's saying one of them is missing.
It's saying one of your assignments is missing?
Mm-hmm.
It's
there, but it says missing next to it. Let me try and refresh it.
Yeah, it's just weird. I've never experienced that.
It's there, but then I look back and the assignment says missing. I'm like, okay.
Anybody else having Mr. Singletary's experience?
Here we go again. It's just showing the one.
So, which one do you see, sir?
The video, abdominal video.
36 assignment abdominal video.
That I see.
You don't see something that says 35 test MT24 endocrine system?
So, Mr. Singletary, if you're looking under the to-do list, mine's not, the test isn't on there, but if you go to the assignments and scroll down, the test will pop up.
Oh, that's annoying.
Oh, it's down further at the bottom?
Like, if you go to the assignment section,
I'm on now.
and then
Go all the way down.
scroll down.
Yeah, all the way down.
And you should be able to see 35 tests.
Or you could also refresh your thing, like go out of it, like close it out and go back into it.
Yeah, I refreshed it twice. It said missing. Is it 35 lecture?
Yeah, it's the 35
NT24.
Mine's missing too. I'm looking through it and I'm trying to refresh it as well. I was getting dressed. I was like, oh shit, let me check.
Okay. Okay. I'll just have to do this later, I guess. Okay,
Yeah.
because it's still
not
showing.
going to pop up on the to-do list. You have to actually go to assignments.
You gotta actually go to assignments to see it, but it should be at the bottom of your assignments.
I was gonna say that's crazy because both of mine show up in to-do list.
That's so weird. It could just
Yeah,
be
only have one.
It just
So
could
I
take.
don't know. On mine, when I go into the assignments, there's on the top right, there's two little gray boxes. One says show by date, and one says show by type. If I click on the show by date, they both appear up at the
Oh, good. That's why we put due dates in there now, is to help them show up by date.
Right.
Yeah.
And it's only on mine. It's only showing the abdominal video.
Huh.
So I'm happy to stick.
And that's by date.
Hold on
We
one
can
second.
figure it out when we get to class.
I'll figure it out when I get to class. I don't want to be late.
Yeah, and I'm happy to stay on with anybody, but the rest of you, it's 11 o'clock. Bye bye, everybody.
Bye.
All right.